They found no time to expand Medicaid in Missouri. Republican senators made it clear this week there will be no Medicaid expansion in Missouri this session. The Republican-led Senate voted down a Democratic attempt to insert $890 million of federal funds into Missouri's budget to expand Medicaid eligibility to an estimated 260,000 lower-income adults. So is that it for this issue this year?
Yes, it's dead for this session, Nick, barring an incredible eventuality here. But yes, it's dead. And what's amazing about this is the one issue that Governor Jay Nixon, in his 5 years in office, he tried harder, pushed harder, was more aggressive on this one particular issue than anything else during his run. Here you have a popular governor just reelected to a second term, and he couldn't get this thing across the finish line. Now, I talked to him yesterday for a story that I have going this weekend, which you'll find on your doorsteps probably on Sunday morning as well.
It's going to be a great newspaper.
It's going to be a great newspaper, yeah. And he says, hey, prospects for it look better next year as more and more Missourians recognize that billions of dollars are being sent out of Missouri to other states, Missouri taxpayer dollars being used elsewhere to fund this program, but not here at home. Time, he says, is on his side. We'll see if it can pass muster next year.
Eric.
And we have an AP story in the call on that same subject this week.
It's going to be a great newspaper this week, yes.
A great newspaper, as well as the curfews and other things that we've been talking about here.
Yes. Dave.
Steve's right. I think we're still trying to figure out why Jay Nixon pushed so hard on the Medicaid expansion. But, Nick, let's connect that dot with the gun discussion. Much of what state legislators now do is cast symbolic votes, votes that aren't really on the merits but say something. The reason Medicaid failed in Missouri and is failing as other states is not necessarily because all lawmakers object to the specifics. They just don't like Obamacare, period. They don't care whether it's good for their state or not. We don't like Obamacare, and we don't want to do anything that would give Obamacare a chance to sort of grow and establish roots. And that's true on the exchanges, that's true on Medicaid, all provisions of Obamacare. So, I think where Jay Nixon may have miscalculated is some thought that somehow he could rationally convince lawmakers to go along with this using the other money going to other states argument, or that we have poor people who need help argument. Again, I don't think lawmakers, either on guns or on Medicaid or a lot of issues, are casting votes based on the merits. They're casting them because of the message it sends, and that's certainly true on the Medicaid decision in Missouri.
But couldn't it also be, though, as many lawmakers talked about, that yes, you're getting federal money right now, Stacey, that yes, it's free money right now from the federal government, but a few years out, the state is going to have to start paying for some of this.
Right.
Where is that money going to come from?
It's going to come from state taxpayers. We're talking about $890 million in the next year had Missouri expanded Medicaid. But in a number of years, those dollars are going to dwindle, and the state's going to be responsible for a bigger part of the tab. The problem is, however, those indigent people, nearly 250,000 people, are still going to get health care. If they walk into a hospital, they have to be covered. And going forward, that's a bigger cost to taxpayers than it is if we expand Medicaid or Medicare in the state of Missouri.
Steve.
Lawmakers in Missouri and in Kansas worry about this fact, Nick. They say after 3 years, the state share begins to grow up to 10% after a few years. What Governor Brownback is saying, look at the federal financial picture. Do you really expect, and can you count on the federal government to truly pay that 90%? Or will the state share become 12%, then 15%, then 25% down the road? State Senator Ryan Silvey in Missouri told me this week Medicaid for the existing program, it grows by $200 million a year. And he says we can't afford what we've got now. We can't fully fund the state public school formula. How are we going to be able to finance this program going forward if, in fact, we buy into this new program?
Very briefly, one of the reasons the Missouri and Kansas state share is so large in existing Medicaid is because the state pays about 40% of the cost of Medicaid for the existing program. The idea in the expanded Medicaid is to limit that to just 10%. So the argument you hear from the other side is it won't cost you nearly as much as the current Medicaid program at the state level.